Hi, Pat.
Hi, Tim.
Welcome to Urgent Care Management Monthly.
Thank you so much.
Are you excited?
I am excited.
Pat is our clinical coordinator at Healthcare Express, and today she's going to talk about the fun subject of dealing with patient complaints.
Yay.
Yay. And you've spent a little time dealing with patient complaints over your career, right?
A little bit of time. Yeah.
Good. And so why don't you kind of start just by telling us, you were talking to me just before we went on film about meeting expectations and how that doesn't work and why customers get upset. So tell me a little bit how that works.
Well, the main thing is the rule of customer expectations is they come in with a certain level of what they expect to get. And what our motto always is give them more than what they're expecting to get. Sometimes that's kind of hard to balance out because every person that comes in, expectations are different.
Right.
They get upset for a variety of reasons. It may be they think their bill was too much, or their prescription got sent to the wrong pharmacy or didn't get sent at all, or they wanted this medication and the doctor gave them something else.
Right.
So it's a variety of different reasons that they're upset, but it's kind of all canopied under one of, their expectations weren't met.
They had a certain level, we met a different level, and so they're either ecstatic because we met the level higher, or they're upset because we made the level lower,
right.
Essentially. Okay.
Right.
That makes sense. The good news is I've never had any patient complaints about me, so I'm pretty happy about that.
There you go. Awesome.
So now we get to the actual complaint. Customer comes in, for some reason we don't meet their level of expectations.
Right.
What do you think about when you approach that customer? What do you do?
Well, there are certain steps that you have to go through to try to even resolve the situation. And the first step is you've got to listen to what their problem is, which is sometimes the hardest out of all the steps to do. When they're upset and they're telling you what they're angry about or upset about, it's human nature to want to jump right into the middle of the story and start trying to fix it. But what you've got to do is kind of back up away from it and just sit there and let them get all the way through. They may have solved their own problem by the time they get to the end of the story. Yeah. So you've got to really, really listen to what their complaint is. And then after that, the very first thing you've got to do is apologize for it. They may not be upset with anything you had any control over, right. But you've got to be the one to step up and take ownership of that problem.
You're apologizing that
their expectations
right.
weren't met.
Right.
Yeah, I'm sorry that happened. And I'm just listen to what their actual reason for being upset is. Right. And the first step is always to say, I'm sorry that things weren't up to par today. I'm sorry that you expected one thing and that's not what you got.
Right.
And then you've got to involve them in the solution. What can I do? What can we do to fix this problem?
Make you happy?
Right. What could we have done that would have made this visit better for you, or
right.
made it be what you were expecting it
right.
to be?
Right.
Sometimes, all they want to do is, they'll tell you nothing. There's really,
let you know.
I just wanted to let you know it's a problem. You can't fix a problem if you don't know that there's one.
Right.
So, you've got to tell them, thanks for complaining. It's a hard thing to say sometimes.
Right, but some of our best customers have done that. Some of our best customers say, hey, we love you guys, you're wonderful, we just really want to let you know this one thing.
Right, this one thing that didn't quite work today.
To help you, because
right.
we think it'll help you.
And it may be something as simple as a training issue to where we have certain guidelines that this is the way we do things every single time, and if you have new employees coming in, there may be one little step that they didn't get in their training, right. or that they didn't understand or didn't stick with them or whatever.
Right.
So sometimes it's as simple as
Going back,
reevaluate
the training, and that's
right.
the third step, right?
Right.
Reevaluate the training and see if people need to be retrained.
Right,
to do the same thing.
And if you realize that it is a training issue, then the big thing is to say, that's not the way our policy states that we do things. I assure you it's not. We will get with this person's supervisor and we will make sure that they know how they're supposed to do it. Right. And then the most important thing is that you get with that person's supervisor and make sure that it actually gets done.
Yeah, I think there's plenty of times I've complained to companies. Well, I don't complain that much, but there's times when I felt like they were just appeasing me, saying, okay, we'll take care of it, but I knew they were really never going to do anything about it.
Hang up the phone and go.
Right,
okay,
yeah. I can't believe I had to talk to that jerk on the phone. So, yeah, I think our idea is let's actually fix the problem. If it's fixable,
and we have so many people that once you tell them, okay, I'll fix it, that like the rest of the service so well that they're going to come back. Yeah. And the worst thing that could ever happen is for them to go, okay, I'm going to go back and come back and have the same problem again
right.
that we promised that we were going to fix.
Right.
So,
because if they're happy, they're going to tell people.
right.
And if they're not happy,
They're going to tell more people.
right. And that can be the problem.
Well,
right?
and and you think of it, if you really like a restaurant, whenever you go to eat, then you're going to tell a couple people that you see. But if you have really bad service or the food's really horrible, you're going to tell every single person that you see that following day.
It's true.
You don't want them to have the same bad experience that you did. Unfortunately, that washes over into everything.
On a completely separate note, what do you think of my ranch?
Beautiful.
Huh? We never filmed out here before, so I just thought I'd show everybody just to kind of brag a little bit. This is where I live in beautiful Texas. So what is your end goal? When you hang up the phone with them, or if they're still in the clinic and complain, your end goal is what?
For them to leave happy. And sometimes it's going to be, like we said earlier, it's going to be a quick fix. They just wanted to tell somebody about it. Sometimes, whenever you say, what can I do to fix the problem, they're going to say, well, I think you should knock $20 off my bill, or, something like that. If it's something that they're asking for that you can do, then, just make that decision and go, okay, done. If they're asking for something that you don't have the authority to say, then, it's okay to say, you know what, hang on just a minute. Let me go talk to somebody. This is who I'm going to go talk to. This is why I need to go talk to them. This is over my realm
I
of
think
doing.
that's a really good point for new urgent care owners out there. If you're the physician who owns it, or you're somebody else who owns it, my advice as the owner would be, if you're going to not want to solve every single problem yourself, you better empower some people to be able to solve that problem at that point of contact. Because the last thing I need you doing is coming to me, asking me every single time if we can do this or if we can do that.
Right.
I have to empower you to be able to make those decisions.
You've got to have a
and solve
policy
those
of, if this is the problem, then yes, you're allowed to do this much of it. But if it pertains to, X-ray, or it pertains to billing or something like that, they've got to have a go-to policy set in place of, this is who I call in this problem, and just tell the patient that that's who you have to talk to, and that's why you have to talk. They want to be kept in the loop, and as long as they're kept in the loop, 9 times out of 10 they're going to be happy with the outcome.
Wonderful. Anything else?
Well, just make sure you do what you say you're going to do.
Do the right thing.
Do the right thing.
Show others that you care.
That's it.